Hello, everyone, and thanks for joining us for Access City Council. I'm your host, David Riggleman, Communications Director for the City of Las Vegas. Coming up on this show, hundreds joined together for a peaceful unity rally. And later, we discuss what medical professionals are doing to ensure your visits to the doctor are safe. The councilman who represents Ward 1 is, of course, Brian Knudsen. He joins me now. Councilman, welcome back to the show. How are you doing?
I'm doing wonderful,
Good
David.
to see
Thank you.
We are here together, obviously socially distanced, as you're going to see
With
here.
a mask.
He's got his mask.
Yeah,
I got mine too. And we're going to have some guests who are also going to be socially distanced, other part of the studio. But it's just the new reality. It's the new normal right now, and we're making do. You know, we're getting through all this.
Life will prevail. We will be fine.
Right, exactly.
Masks don't stop us. We are totally fine.
And I like your mask. You got it's a Battle Born.
Battle
like
Born,
yeah. Very nice.
Yes.
Very nice. So I'll have to talk to you after the show where you got that. I'd like to get one of those myself. So, hey, you know Ward 1 like the back of your hand. It's your neighborhood. It's really in the heart of our city. That area appropriately with the 1 on it. It incorporates some of our downtown area. The medical district is clearly in Ward 1. We're going to talk about that today. But it's the area that basically runs along the south side of US 95 and makes that curve as it heads up into the northwest. But if you live in that area or work in that area, then you are in the city limits of the city of Las Vegas, and you are represented by Councilman Brian Knudsen. You've been on the council almost a year now, right?
On Friday, we'll make 1 year.
Yeah, 1 year, exactly.
Yeah.
So
I'm very grateful.
It's gone by fast.
At times, it's gone by fast. Other times, it's been dragging.
Right,
Last few months have been dragging a little bit.
You know, I have to say, of all years to come onto the council, 19 wasn't bad, but 20 has been a challenge.
Right now, I'm looking forward to 21. I'm sure there's some wonderful things in 20, but I haven't seen them yet. So
exactly.
that would be how I feel about 2020.
Me too.
The back half, I think, will be
too.
better than the first half. 21 will be amazing.
I hope so. From your mouth, I hope that's the case. So, a lot going on in the community. Of course, we've got COVID-19 still going on. We're going to talk about that. Of course, the backdrop to all of that was the death of George Floyd and the whole wave of events across the nation that started. You posted this on Facebook. You said, "I stood in solidarity with the black community in the city of Las Vegas at the We Deserve to Live Black People Matter rally and candlelight vigil for Black Lives Matter." Now, this was over at Palacio Park back on June 6th. This is key, everyone, because this was one of the largest rallies. There have been many rallies, many demonstrations over the last several weeks. This was one of the largest, and it was a very peaceful demonstration. Sort of set the tone for all the demonstrations to follow. Everything's been peaceful, thank goodness, since then. We did not see that initially. There was some violence right up front, but that night moving forward, and you were out there. You and about 2,500 other people were all out there that night. So.
Yeah, and I think it's important the violence that happened in some of the protests were really caused by outside people. They were arrested. Metro has taken account for that. Why this is so important is for me in particular, is I've spent the last 15 years of my life working mostly in education and learning so much about housing and transportation and education and all these public systems, and you can see systemic racism when you get right down into it. And so I organized a lot of community members in my early stages of my career to learn more about how you can support really children in poverty, which in our community is predominantly children of who are Latino or African American.
Of color, right.
And what I did was I had community leaders go out and interview principals to find out why is there challenges in our education system and why are children in poverty struggling so much. And when you talk to people in schools, you find out everything you can about children and the environments they come into, or they come from. There is opportunities to improve. And so that is one of the reasons why I ran for office, is we can improve, we can be better in our community and serve all people. It's equity and it's equality, and making sure that people have what they need to be successful and live a good, decent life. And we have an obligation as a society, as a human race, to do that.
And really, that's an American story. There's so many people who've come from modest means in this country who've achieved great things. So that's the idea, I think, is what your point here is that given the chance, how many other great leaders, great thinkers, great business people are out there? They just haven't had the opportunity to get on that path. And I think that's exactly what you're saying. But our country has a history of seeing that happen. So it needs to continue.
We need a mindset. We need a mindset shift, and sometimes that takes walking in the streets and walking in the sidewalks and peacefully saying, we can be better.
Right.
And I think the Black Lives Matter movement is an amazing way to say to the police force to say, we can be better. I've spent my time in education, and now representing the medical district, I get to spend my time focusing in on improving access to and quality of healthcare, and that's my way of saying we can be better than what we currently are. And that's, every one of us should be thinking how tomorrow can be better than today.
Yeah, and you know what? Everyone, it's so apropos. It all starts with each of us, right?
Yes.
We make the difference. You can worry about what others are doing, but until you take a hard look at yourself, nothing's really going to ultimately change, right?
That's right.
So, great point. And in great segue too. You talked about the medical district. You are on the health district board. The medical district is in your ward, and you've been very active in a number of things we want to let everybody know about. The Just One project.
Yes.
You guys went out and delivered food, right? Tell everybody what Just One is and what the effort's all about.
First of all, it's a team. It's never just me. So it's Dorian Stonebarger works with the Just One project. Carl Catarata helped, and Antonia Preciado helped. And Antonia's mom was there as well. And so the Board of Realtors was there, and it was a whole group of people that served food to people waiting in line. And so our Ward 1 team, we went around and delivered stuff for the children, and we made sure people knew how to get a hold of the city of Las Vegas. Mm-hmm. And then the team of people that were out there, there's probably 75 people, including Bolden Area Command and the Metropolitan Police Department, delivered packages of food to people who drove up, socially distanced and stayed in their cars, and were able to get food for a week.
Yeah, and this is for folks. This is especially during the pandemic when people weren't able to get their unemployment benefits for whatever reason. They just didn't have any money coming in, and so this was a way to make sure that no one at least was hungry during that time.
That's right.
And very challenging.
And we need to continue doing that because there are people in our community that won't have access to food, and so this provides them access, and it's a great way to give back to your community. So if anybody wants to get engaged, the Just One project is one way, but there's 1,000 ways. So
Exactly.
reach out. You can reach out to me. You can reach out to your neighbors to find out a way to give back to our community.
Yeah, that's such a great point. A lot of great nonprofits here in the community that make sure that no one goes hungry. You know, that in America, anywhere in the world, no one should go hungry. So great organization. And the folks you mentioned, the names you mentioned, Antonia, Carl, and Dorian, those are all your staffers. And so all good.
We are a team. It's not any one person that can do any of this. So it's a team of people that make it better.
Good people, good group,
Yes.
good group all the way around. And those are the folks too, by the way, if you contact his office, you're going to speak to one of the four of them when you reach out. And so Antonia, Carl, or Dorian, or the councilman themselves. So you posted this on Facebook too. You said, stop by University Medical Center of Southern Nevada, located in Ward 1 in the Medical District, to drop off some lunches for our doctors and healthcare professionals. I thought this was a wonderful gesture. These folks, you talk about being on the front line of everything. Wow. They've seen it all through the pandemic. Of course, at University Medical Center, they're treating people for everything else besides COVID-19. They come in for car accidents and appendectomies and everything else that they see. So busy place, and I know they've been just working around the clock.
Yeah,
so.
and I always will say University Medical Center is the hospital that saved my son's life, and so I've spent many nights sleeping at University Medical Center. I'm familiar with the doctors and nurses, and they've just done a great job. And for that lunch order, it was Peter Palavos that organized it, along with Voice of the Vets, and so I was fortunate enough to be there and thank them for the work they're doing in our community.
How many meals was that? It looked like it was quite a few.
It was 100.
Wow,
yeah. So,
nice, very nice.
So it's a little thing, but it's a big thing when you're hungry.
Yeah, exactly. And just to have somebody say thank you.
Yeah.
Sometimes you feel like you're in it all by yourself, or just you and your team. But when people outside recognize, hey, thanks for what you're doing, thanks for keeping it together, we need you, it goes a long way. Yeah. So good stuff. University Medical Center is our only level 1 trauma unit here in Southern Nevada. And so people who are seriously injured or have really dire conditions, other hospitals are great and have good facilities. But if you're in a bad accident, for example, or you've been burned, UMC is where you're going to go.
That's the place to be.
Yeah, for sure. And if it's a public hospital, so sometimes people have kind of a misconception of what UMC is, but it's a flagship here for sure.
It's the trained physicians and amazing nurses that make the experience important and critical and life-saving. And so that's what people need to focus in on, is how do you get the very best care, and University Medical Center is one of those places. Valley Hospital in the medical district is another.
Yeah, it's right next door. Yeah,
That's right.
Yeah, exactly. Good stuff. And speaking of the medical district, you posted this on Facebook. You said, "We launched our Welcome Back, Your Doctor is Ready for You Now ad campaign with the Vegas Medical District partners, Clark County, Nevada, and my fellow city council colleague, Councilwoman Olivia Diaz." This was really important, Councilman, because during COVID-19, some medical facilities, dentist's office, for example, were taking patients on a regular basis unless you had an emergency. But doctors' offices were open, but people just weren't going. I think everybody was afraid of coming in contact with somebody who might have the coronavirus, and so they just weren't going. They just weren't going to the doctor.
Yeah, and I have an amazing opportunity being a city councilman. I get to talk to the leaders of all these different organizations, and on a call that we facilitated about 6 weeks ago now, all of the hospitals and clinics were saying that people had really stopped coming in to go see the doctor or dentist or mental health professional or substance abuse professional. And so
all bad.
What we talked about was we need people to go back because we don't want them so afraid to go out of their home because of COVID that they struggle with other health, mental or physical conditions. And so the city of Las Vegas, your team, in fact, David, just did a really great job, Aaron Sebelius, putting together a campaign in partnership with UNLV, UMC, Valley Hospital, to make sure that people know it's safe. And for all of the viewers, I wouldn't do anything I wouldn't recommend anybody else. I took myself into the doctor. I went and saw my primary care physician, who is at the Southern Nevada Health District in the Community Health Center. I had a COVID-19 test done. I had a complete physical. Everyone wears masks. It's a safe environment for you to be in, and it's important to take care of yourself. And so even though we have COVID going on, you have to take care of yourself, and we have amazing providers in the medical district and throughout the valley. It's time to go back to the doctor.
Yeah. That was the message, because, as you said, Councilman, people have been reticent to do that. We mentioned dental offices. Unless you had an emergency, you really couldn't come to see the dentist. But the dentists are open now. You get your teeth cleaned. If you've got some issue, cavity needs filled, whatever, they can do all that now.
I have my dentist appointment in 2 weeks.
I've
and
already been.
My children's dentist appointment with UNLV School of Medicine is a month from now.
Very good.
I'm anxiously awaiting getting my children's teeth checked.
I've been to the GP, but I have been to the eye doctor, and I've had that checked. So, but it was weird going in there the first time. Different. If you've not been, know that it's going to be the new normal. They're only letting so many patients in at a time. You kind of queue up, you stay in one area, then they ask you to come to the desk. There, in my ophthalmologist's office, there were plexiglass screens set up, and it's just the way we're going to do it these days. But they had hand sanitizer, and they checked temperatures, and so I felt safe. I felt like, they're on top of it in here. They're not going to let someone in who's sick, and
it's okay. It's okay. I know there's so much turmoil in the world, and there's so much angst, and nobody wants to see change, and change is the most complicated thing any of us can deal with, and this is a substantial change that we've all had to deal with. Once you do it, you get out, wear your mask. My mask is right here. Wear your mask. It's going to be okay. We can do this together as a community, as a state, as a country, as a world. We can do this together. We'll get through it. It's not terrible. It's okay.
And we should point out, if we haven't already, Councilman is also on the Health District Board, the Southern Nevada Health District Board. So he's got insight from that, as the medical districts in his ward. So as you pointed out, you're getting information from healthcare professionals from all sides of the community of what they're doing and what they're doing to keep everyone safe. So.
And the easiest, simplest thing is wear a mask.
That's
what you do to keep yourself safe, keep your family safe, keep your neighbors safe. Wear a mask. It's okay.
Exactly. And social distance like we are right here.
Yes.
That'll help too. So if we can slow this thing down, then we can maybe start getting back to some semblance of normalcy around our country and around our world. But in the meantime, we've got to do this, and let's get this thing knocked down and get on with our lives then. So, well, great discussion. We want to tell everyone out there, we're going to talk more about the Welcome Back campaign with the deans of the UNLV Nursing and Dental Schools. That's going to be right after this. We're going to take a short break. We'll see you in a few minutes.
Welcome back. Your doctor is ready for you now. Your personal health cannot and should not wait. Southern Nevada's healthcare community is taking very seriously and putting into practice protocols to protect you while addressing your health concerns. Your doctor, your dentist, your primary care physician, and your medical provider are ready to see you now. Please make your good health a priority and make your appointment today.
Welcome back, everyone. As we mentioned before the break, a campaign is on right now to encourage people to go back to see their doctor or dentist. And we're glad to have with us two doctors from UNLV to discuss why your health care should not wait. Dr. Angela Amar is the Dean of the UNLV School of Nursing. She's in the green. And Dr. Lily Garcia is the Dean of the UNLV Dental School. Thank you both so much for being with us and for social distancing in the other end of our studio. So thank you so much for being here. I know a councilman appreciates you joining us. He's been part of the effort to encourage people to go back and see their healthcare professionals because, as we were saying before the break, a lot of people just have not done that during COVID-19. I think afraid that they might catch it at the doctor's office or become in contact with another patient who might have it.
That's right. And I think having Dean Amar and Dean Garcia here is incredibly important to me because if you go to the doctor, it's the nurses that are really going to provide some of that care that you're going to need. And I have personal experiences with nurses at UMC that were just incredible and made the whole experience okay for us. And my son still remembers the nurses that treated him. And so incredibly grateful for the nursing community, and Dean Amar is responsible for much of our nursing community. So I think it's important to celebrate nurses. And for dentists, my children go to the UNLV School of Dentistry, and the dentist can be an interesting experience with children. It's something new for me, but the dentist
it can be an interesting experience for an adult too.
For an adult, the School of the School of Dental Medicine really kind of helped me figure out how to be a parent with my kids.
Oh, that's great.
Seeing a dentist, and so
should have done that. Maybe
celebrating dentists and nurses is part of this campaign as well as making sure that we know that the whole healthcare community is safe and they're here to make us feel better.
Yeah, that's great. That's well said. Well, Dean Amar, if you don't mind, if we could start with you. Angela, a quick question for you. Do you think that people are still worried that going to see their doctor, their dentist, there's going to be a danger in that somehow they might come in contact with the coronavirus doing that?
Yes, I think the coronavirus has had so much uncertainty associated with it. So when you think about all the things that we were told early on, we were told not to wear a mask, now we're told wear a mask. We were told it was only older people, then it became younger people as well. It didn't affect children, now it does. So it has created a whole lot of uncertainty. That said, this is a health problem, and our health community has really rallied to figure out how do we help best manage it. And so hospitals have all kind of protocols. I was actually working myself as a volunteer at UMC, doing all the checks of people as they come in. Every place you visit has all of the appropriate protections to keep people safe. And what people sometimes forget is that the longer you ignore something, the worse it becomes. Little problems become big problems.
Dr. Amar, Angela, hit on that a little bit. You talked about what healthcare professionals, who knows about not spreading disease better than a healthcare professional, but help people understand just all the lengths. I've been to the eye doctor, I've been to the dentist. It's different. They are really, really ramping it up as far as safety. Help reassure the public out there that when they go, they're going to be in good hands and in safe hands.
Yes, so this is a public health problem, a big health emergency problem. So when any office that you go to has taken real precautions to make sure that people are social distance as they're in the waiting room, that there's no clamoring of people, that the chairs are marked off so that you can only sit in certain spaces. Your loved ones can't come in with you because we don't want to have any extra people in the space. Mask, we found, can be very protective. Most of the people who have any symptoms or say that they could be having COVID symptom disease things aren't going to be in that office with you. They aren't going to be there. They're going to be in another place because we're going to send them off to get tested. And so anybody who's there has made it through all the screens, has made it through all the health precautions. And so it is a safe place for people to go to and a safe place for people to get the help that they need.
Good, well said. And again, that's been my experience exactly the same, Brian, this is what you were saying as well. When you've taken the kids, when you've gone yourself, the experience has been that it's very safe that they're taking all the precautions. And if you haven't been to see your health professional, that's what you're going to encounter.
Now's the time to go back. If you need to see a dentist, if you need to see a doctor, a mental health professional, now's the time to go back.
Yeah. Dr. Garcia, I'd like to talk to you with you as well. Dentist office were closed initially during phase 1. You could only go unless you had an emergency. You weren't able to go. But now during phase 2, you get your teeth cleaned. You can go see your dentist. Different though, just like Dr. Amar was saying, it's a different environment when you go in there. Fewer patients at a time, more social distancing. And I noticed my hygienist had, she always wore a lot of equipment, but she had more on this time than last time around as well.
Correct. We are doing enhanced PPE. What people are seeing is we've normally done that in dentistry because we're the typical providers who work with people, and you have what's called aerosol generating procedures.
Right.
So you see a lot of the spray, the water spray, when you're getting your teeth cleaned. Most dental offices, and under all the controls of CDC and the American Dental Association, as well as in our governor's directives, we've been following it very closely. We've remained open to take care of emergency, non-emergency, and now we're going into elective procedures that have been postponed. Unfortunately, people have some genuine fear with dentists anyway. But I want you to see that when you come in, you'll see visible differences. You'll see people with more face shields than you did before. And we're not using, and we're minimizing the aerosol generating procedures as much as possible. So your hygienist may be what's called hand scaling, using the hand instruments to avoid some of those issues. But when you come in, we're going through all the safety protocol, the screening procedures. If you don't have a mask, we give you a mask. And we're hearing patients say it feels safe. And sometimes you may think it's safe, but until you feel it, it means a difference. And so we want people to feel that comfort when they come see us.
So true. But you know, Dr. Garcia, Lily, that has exactly been my experience at the dentist. As you laid it out, I went in just for a routine cleaning. That was exactly my experience. They've always been very, very safe in that dentist's office, but this time there was a face shield and the scaling exactly right. There wasn't the spray, which my hygienist, she likes the scaling anyway. So she says it does a better job. I don't know if you would agree or not, but that was her approach. And so I felt safe. I felt safe in the office, and just the procedures are coming in. It was they'd made it clear when we arrived what we were supposed to do. Wait to step up to the counter until we were called forward. They only had one. There was in the waiting room. There was just me and one other individual. So obviously they're doing all the things that you just laid out, and like you say, it does make you feel safe, which is going to encourage you to go back, right?
Yes, and we want you to come back. A lot of times you may not have pain. That doesn't mean you don't have disease processes ongoing, whether it's some sore on the lip or other issues. So pain's not always an indication, and even gum disease, you might find it's not painful, but we want you to keep up with everything because we don't want anything to progress without being addressed or at least checked. And especially at the School of Dental Medicine, you walk in, we have a larger facility. So our students learn by taking care of patients, and that's why we're so pleased that so many of our patients are coming back and they're feeling good. We call them the night before, we ask them questions when they come in. We want to make sure they're safe and everyone else around you, because we have a number of staff who are making sure we're doing what's called four-handed dentistry. Whereas before, dental students may have worked by themselves, we're making sure they have additional help to mitigate or minimize the kind of spray that may happen on some procedures. So patients are feeling the difference, and we're so grateful to them for coming to the School of Dental Medicine, because without them, our young student doctors and our residents wouldn't be able to learn what they're learning now.
Yeah, that's a great point, Dr. Garcia. If you don't have the students working on patients, they're not going to learn anything. So yeah, going back to the dental school, going back to the dentist is important. Councilman, you had talked about this too during the campaign. You mentioned don't wait for the pain. You can have a condition that's worsening before you feel the pain. So, and as Dr. Garcia just alluded to, that's not the indicator to go back. You need to go get the routine checkup in the meantime.
Prevention is, what is it? An ounce of prevention is worth a pound of cure.
Exactly.
And we also, these are students, so nursing students, dental students in the medical district, and they are the medical district. So when we think about, who's going to the medical district, we think about patients and doctors and UMC and Valley and the health district, but it's nurses and nursing students and dental students and medical students that I think are the bulk of people that I want to focus on, in addition to the staff and professional staff of the entire area. And so making sure those students have enough cases and examples to learn from. My children are great people to learn from because they're very challenging in the dental office. But this is who the medical district is, and this is why I ran for office, is because making sure those students have the right environment to learn and to grow and to expand their knowledge base. That is how we will create a greater environment for the quality and quantity of healthcare in Nevada. So it's important to me to have Dean Amar and Dean Garcia on this show and part of the medical community within the medical district. So it provides a guiding post of how we can grow the medical district so that we have great access to healthcare here in Southern Nevada.
Yeah, very well said. And we want it to be one of the best in the country. That's what we're shooting for here.
The best, not one of the best.
Exactly, the best. There you go. That's a high bar.
Yes.
Dr. Amar, Dr. Garcia, I'd just like to give you both an opportunity. Do you have anything you'd like to add, some words of wisdom for our viewers out there about getting back to see their healthcare professional? Anything you'd like to add that we haven't hit on?
Well, for us at the School of Dental Medicine, we're so excited the university actually reconstructed our parking area. So there'll be very convenient parking.
Oh, there
for
you
to come
go.
in.
See, it's another bonus.
Right, and then you'll feel a difference, and we're doing our best to take good care of people as well as maintain the safety and well-being of our faculty, students, and staff.
Excellent,
so thank you.
excellent. Dr. Amar, how about you? Is there anything you'd like to add that maybe needs to be said that hasn't been already?
Well, I would say that nurses journey with people through major life events, good events, bad events. So we're there when people have babies, we're there when people die, and we're there for everything in the middle. And so I think one of the most important things to remember now is that this is a stressful time. There's so much change, so much unrest, and so making sure that people practice self-care. We're all at home, which is supposed to be healthier eating, but we're all eating way more than we've ever eaten before. So thinking some about having vegetables and fruits in your diet, and exercise, and going outside, and doing the things that make us feel whole and complete, and so that we figure out ways that we decrease our stress. And when you come to whatever healthcare setting you come to, you can rest assured that there'll be a nurse, and I would say a good nurse, who's there and ready to help and journey with you through whatever you're going through.
Yeah, very well
And
said.
thanks for having me.
Oh, it's great to have you on. You both did a fantastic job. UNLV has got some great people at every level, as we just saw, Dean Garcia and Dean Amar there. So thank you both for being on the program. Councilman, we're running out of time here, but we want to tell everybody out there, hey, we always want to hear from you. So if you have something you'd like to share with Councilman Knudsen, you can find him on Facebook and Twitter. He's very active. And you can also contact him by just picking up the phone. We still do that around here, 702-229-6405. Or you can send an email. His address is bknudsen@lasvegasnevada.gov. And he and his great staff, they will get right back to you. So great job. Good to see you again. We'll have you back in 6 weeks.
I appreciate it.
Keep up the good work in the meantime.
Thank you, David.
All right. Thank you so much. And don't miss our next show beginning on July 9th with Ward 3 City Councilwoman Olivia Diaz. You can now catch all of our KCLV shows on Apple TV, Roku, and Amazon Fire. And don't forget, you can watch us live on the internet at kclv.tv. Thank you for joining us. This edition of Access City Council is coming to an end, but we know you'll be back. We'll see you next time. We hope you stay safe in the meantime. Thanks for joining us, everyone.